AIDS 40 years later.
Well, the Desert AIDS Project is gearing up for its 25th annual Steve Chase Humanitarian Awards this weekend. In honor of that, NBC Palm Springs is doing a 5-part series on the history of HIV/AIDS and where we are today. So let's go back to June 5th, 1981. The CDC reported a form of pneumonia found in 5 gay men in Los Angeles. That was the start of what became the HIV/AIDS epidemic.
AIDS, acquired immune deficiency syndrome.
There is no cure, and it is often fatal. They are dealing with some new, deadly, sexually transmitted disease.
The summer of 1981.
AIDS is now the leading cause of death among young people.
Was the beginning of the end for so many.
It was as close to a war zone as anything I had ever seen.
Kevin Bass was living in West Hollywood when the AIDS epidemic started.
And I was in my early 20s, which should be a time of joy and exploration. And don't get me wrong, it was, but it was done with such fear.
Fear because Bass lost half his phone book.
There wasn't a single month in the mid-'80s through the early '90s that I did not attend minimum 3 or 4 memorial services.
The Centers for Disease Control says since the beginning of the epidemic, over 700,000 people have died with AIDS in the United States.
Back then, in 1980s, we thought that all HIV/AIDS patients were dying because of HIV and AIDS, but later on we found out they were because of opportunistic infections that attacked the immune system in the body.
People were dying every day, and so you couldn't get in front of the grief.
Grief, but also paralyzing fear, because at the time, no one knew what the disease was.
We often thought that it was a death sentence.
The disease was labeled the gay man's cancer, officially called GRID, gay-related immune deficiency.
Then you have the shame of, oh my God, people know what I may have done behind closed doors. To walk into your work and to see young, vibrant men with long sleeves in the middle of the summer because they were hiding their Kaposi sarcoma, so they had big purple splotches.
Acquired immune deficiency syndrome is a terrifying and mysterious disease.
Others get an infection known as pneumocystis pneumonia.
But despite all the alienation from employers, medical professionals, and the country, there were those like Kathy McCauley with a huge heart.
I never was ever afraid of catching a disease.
At the time, McCauley was working as a nurse for Riverside County. Unlike most, she didn't shun the gay community. She just wanted to help.
I hugged every patient that came in.
So secretly, she gathered a volunteer group of medical professionals. They set up a clinic in Palm Springs. And even though there were no answers, they would test and try to treat anyone in the dead of night.
That's all we wanted them to know. We love you, and we're not afraid of you.
It was that love that turned that little secret volunteer clinic into what we now know as Desert AIDS Project.
Desert AIDS Project has learned so much through the tragedy of the AIDS epidemic. We've learned to build a holistic healthcare model.
And despite so much death and horror, Bass says there is some good that came out of it.
If there ever was a silver lining in the 80s and 90s with this horrible, horrific epidemic, it was that the LGBT community actually came together as one.
Came together to form a community still standing strong.
I was standing out in the hall today, and I was looking at all the people going in and out and coming in this door and out that door. And I thought, what a dream.
And what's really amazing is that today, Desert AIDS Project does so much more than treat HIV/AIDS patients. It truly is a holistic healthcare provider. We'll have more on Desert AIDS Project and the history of HIV/AIDS each night this week. Tomorrow night at 5, we'll hear from those thriving with HIV/AIDS today. Now, of course, this is all leading up to the Desert AIDS Project's 25th annual Steve Chase Humanitarian Awards this weekend. Coming up at 6:30 this evening, we'll have a live interview with Dr. Tulika Singh to talk more about HIV/AIDS and where we are today. Gina?